Now let us discuss the drug products that are traditionally used containing plants as active ingredients. Good afternoon everyone, we are the Group 5 and we will discuss Administrative Order number 184 series of 2004. The aforementioned Republic Acts and Executive Orders aim to regulate traditional used herbal products in general. Although this may seem simple and basic enough, the terms used have abundant meanings. Let's break down the terms used in order to fully explain and explicate the order. Firstly, the Department of Health, through BFAD or Bureau of Food and Drugs, is the organization responsible for the regulation of said traditional used herbal products. Within the regulation involves multiple responsibilities, ensuring the safety, the quality, and the label itself, which is traditionally used herbal products. Consequently, said products have their own definition. Preparations from plant materials whose claim application is or are based only on traditional experience of long usage, which should be at least 5 or more decades as documented in medical, historical, and ethnological literature. Now that we have broken down the meaning of each term, why is this order in effect? What is the significance of such law? There are multiple reasons. As with the definition of traditional used herbal products, there is an element of antiquity. With that antiquity comes the need for re-evaluation of their uses, as such method may no longer be beneficial during the modern context. Moreover, such products may even prove harmful to those who still abide by them. With the stipulation of 5 decades or 50 years, there certainly have been advancements made in the science and research field that show alternative, safer, and more even effective products to their traditionally made counterparts. Although it isn't necessarily the case, the regulation of these products may be useful for the general population, since there will be a standard for their quality, safety, and other traits. Consumers will be assured of the products once they undergo BFAD certifications. Not only that, there is now an organization responsible for the products and how they might affect the consumers. This makes it easier for the people who are buying in whom to approach whenever there are problems with the product they bought. On a more personal note, I think this is a necessary advancement in science, society, and culture. Regulation via government organizations typically entail a long process of registration, applications, and certification. Although such labels may prove beneficial, the products of attaining them may not be as accessible to the small-scale companies that sell these herbal products. Another thing to note would be the cost. As businesses come, the price premium is usually pushed to the customers in attaining said certifications. In turn, the products may come at a higher value, which could defeat the purpose of them being bought and alternatively to their modern counterparts.
Good afternoon, everyone. Let me now discuss to you the definition of terms and policies and guidelines of this administrative order. You can see on the screen the definition of terms that are related in this order. So most of us naman are familiar with the definition of these terms because we always encountered these terms in our past subjects such as botany and pharmacology. Ang highlight lang nako diri is the definition of the traditionally used herbal products. So, traditionally used herbal products are products of the plants na naay applications based on traditional experience of long usage. It is important na ang traditionally used herbal products should be at least 5 or more decades as documented in medical, historical, and ethnological literature to ensure its effectiveness and safety. For products naman nagikan from other countries, the Philippine Consulate ang responsible na mag-authenticate sa documents to verify if the documents is legit. Now that we know the definition of terms, let's now proceed to policies and guidelines. There are only 2 policies and guidelines ang naa sa Administrative Order number 184. The first policy is nag-emphasize sa importance of having a valid license. This means na ang mga establishment for traditionally used herbal products with a valid license to operate lang ang maka-apply for registration for such traditionally used herbal products. If no valid license, no registration for such products. The second policy naman is, ang meaning ani is people should not manufacture, distribute, advertise, or sell any traditionally used herbal products if it is not registered to the Bureau of Food and Drugs. They must first register the products to the BFAD para ensure sa BFAD na it is safe and effective to use by the public. If registered na, pwede na i-sell, manufacture, advertise ang herbal products. People who will not follow this policy will face sanction. That would be all.
Now let's go to the registration requirements. So first on the list is the notarized letter of application and duly accomplished form number 8. Second, certificate of brand name clearance when applicable. Every proposed brand name for a traditionally used herbal product shall be submitted for name clearance prior to the filing of an application for registration. The purpose of this is to prevent similarities in brand names with other previously registered products, whether food, drugs and devices, cosmetics, or household hazardous substances. In addition, no certificate of brand name is identical or similar to any brand name registered with the Bureau of Food and Drugs or the BFAD shall be provided for any imported traditionally used herbal product, even if it is patented and or registered in other countries. Application, processing, and approval of brand names shall be in accordance with the provisions of Bureau Circular No. 21 Series of 1999 and Bureau Circular No. 8 Series of 2003. Third, registered requirements, a duly notarized certificate of agreement executed between the manufacturer, trader, importer, and or distributor. Next is the list of all active plant materials and inactive ingredients. The manufacturer must include the complete list of active and inactive ingredients, as well as the equivalent amount per unit dose expressed in the metric system. In addition, the active ingredients or the plant materials must be stated using scientific names with a common or local name placed beneath the scientific name. Specific plant parts used shall be stated after the common name. Furthermore, ingredients which are used in the manufacture but which may not be present in the finished product shall be included in the list. For example, alcohol. Alcohol, if present in the formulation, shall be expressed in percentage. Number 5 is the requirements for raw materials of traditionally used herbal products. A certification as to the authenticity of the plant specimen shall be obtained from the Philippine National Museum or any BFAD-recognized taxonomist. In any case of imported products, the certificate of authenticity of the plant shall be obtained from the authorized government agency in the country of origin, and the Philippine consulate shall duly authenticate such document.
We're done with the first 5 registration requirements, and now we're going on the 6th, and that is physical description and test or quality standards of the finished product, where it should contain the following descriptions: organoleptic and macroscopic description of the finished product, where it is a description of the appearance, color, texture, odor, and taste of the finished product, also its moisture content, pH, and alcohol content, if applicable. 7th requirement is the certificate of analysis of the submitted samples, where it is an analytical report of the test carried out to establish quality, identity, and safety of the submitted batch samples. 8th, full report of the methods used, the facilities, and quality control procedures in manufacture, processing, and packaging of the finished product, where it is a complete and detailed description of the manufacturing procedure, including all process, the quality control procedures, the facilities, the equipment used in each stage of manufacturing process. 9. Complete quality control procedures for the finished product, where the manufacturer shall ensure that all quality control test procedures for the finished product is given in detail, including the preparation of test samples for the analysis on providing an information on how the quality and batch-to-batch uniformity is ensured. The data obtained from this test shall also provide information about the absence of synthetic substances and microbial contaminants. Lastly, the finished product should comply for the general requirements for the particular dosage forms. 10th registration requirement is the stability studies to support claim shelf life of the finished product. These stability studies conducted under the following recommended conditions shall be done to determine the most appropriate condition of storage and to support claim shelf life with its recommended room, elevated, cool temperature, and their relative humidity.
So for this part, I'll be talking about the registration requirements number 11 to 13. Requirement 11 concerns the labels and other labeling materials that will be used for the herbal products. The article states that all information should be clearly printed in English or both in English and Filipino with distinguished color contrast and spacing. The minimum mandatory information in the labeling materials, which is displayed on the screen, includes the official name, dosage form, storage conditions, and more. The principal display panel shall contain particulars required in 11.1.4.1 to 11.1.4.5. On the other hand, particulars required in 11.1.4.6 to 11.1.4.12 shall appear outside of the principal display panel. The other information and details shall appear on other labeling materials. With regards to the formulation, the active ingredient is stated in its scientific name with the common name and part below it, wherein the plant part used should be stated after the common name. Potency of the active ingredient should be expressed in the metric system, while the alcohol content is expressed in percentage. Furthermore, specific requirements include the printing of various phrases in all labeling materials, such as, if symptoms persist, consult your doctor. The folkloric claim shall be presented in layman's term, and the statement saying that the product has not been evaluated by the BFD shall be in an outlined box parallel to the base of the label. Requirement 12 concerns sufficient samples of the product in commercial presentation for laboratory analysis, complete with the batch and lot number. The same as that on the submitted certificate of analysis shall be submitted for the BFAD analysis. Requirement 13 covers the evidence of safety and claimed application. The evidence of safety shall be based on the documentation of prolonged and uneventual use of using the product. Absence of potential toxicity, carcinogenicity, and teratogenicity is expected. Evidence for claimed application shall be based on medical or pharmaceutical literature or historical and ethnological documents. No product shall be registered as a traditionally used herbal product if there are reports of adverse drug reactions, abuse, dependence, or if it contains therapeutically active substances, such as isolated constituents of plants used in conventional medicine. For the importation of the traditional used herbal product, a certificate issued by an appropriate agency from the country that is authenticated by the Philippine Consulate is required. No product from other countries may be registered unless they are freely sold in its country of origin. Lastly, in cases where the product is not freely sold in the country of manufacture, two separate certificates shall be submitted, one from the country of manufacture and one from the country where the product is freely sold. That would be all. Thank you.
Hello everyone, for this part I'll be discussing the procedures for registration, the prohibited acts and sanctions, repealing clause, and effectivity as stated in Administrative Order Number 184 Series of 2004. For the procedures for registration of traditionally used herbal products, the first step is the filling of application for registration, in which the article states that a duly licensed traditionally used herbal product establishment or applicant in this case shall file a formal application by submitting data and representative samples of the product in support of its request for registration. Such establishment can be the product's manufacturer, the trader, or importer-distributor. In this step, the Product Services Division of the Bureau of Food and Drugs, or the BFAD, evaluates or reviews submitted documentation and samples and makes a final action on whether to approve or deny the registration application based on the results of the evaluation. The second step is the payment of registration fees and costs of laboratory analysis. Upon application, these are the following non-refundable fees charged for each application. First is the initial registration, which may be valid for 2, 3, 4, or 5 years with payment of corresponding fees shown on the screen. Second is the renewal registration, which is for 5-year duration, starting on the date of expiration and indicated on the Certificate of Product Registration or the CPR. For the prohibited acts and sanction, the prohibited acts and sanction embodied in Republic Act 3720 as amended by Executive Order Number 175 as far as applicable are hereby adopted. Repealing clause, all orders, circulars, rules, and regulations or portions thereof that are inconsistent with this order are hereby repealed or modified accordingly. And finally, for the effectivity, this regulation shall take effect 15 days after after it is published in two newspapers of general circulation. Two newspapers of general circulation. And this concludes our report. Thank you for listening.